Lacerations may occur to two tendons in the same digit, for instance to the FDP and FDS. Since both require retrieval and repair, both should be delivered to the palm. Should then be placed in the anatomic orientation prior to proceeding, as was just demonstrated in the procedure for retrieving a single tendon. Each tendon stump should be sutured independently. And one suture pair at a time should be passed through the plastic sleeve. Then all 4 suture strands are used to draw the 2 tendons simultaneously to the distal incision. The repair connecting these tendon stumps to their respective stumps is then completed with the same sutures and needles that were used to retrieve the tendons.